Can edging be addictive? Hi, I'm Luke Vu, clinical psychologist, mental health expert, helping young men overcome digital addiction, depression, and anxiety. Today, we're talking about a topic that's often misunderstood: edging and the effects of deliberately delaying climax for pleasure. Quick disclaimer, I'm not your psych, this isn't treatment, and if you need a psychologist, you should find a registered, qualified psych in your area. Let's dive in. What is edging, and why do people do it? Edging means masturbating in a way to stay highly aroused for an extended period of time while intentionally delaying orgasm. Some do it consciously to make the climax stronger. Others do it unintentionally as they scroll, search, and layer stimulation without ever finishing. On a side note, there's also an entire genre of porn dedicated to this style of consumption. While edging can happen without media, it's most commonly used with pornography. Why? Porn offers infinite novelty, multiple tabs, perfect pacing, and total control. You don't need to perform, you don't need to negotiate, and you don't need to compromise. You're alone and in charge. Can edging actually cause problems over time? Edging in itself isn't bad. It can be useful for exploration or managing premature ejaculation. But when it becomes a habit, especially with intense porn use, it can lead to some issues. Let's take a look at some. Emotional and psychological impacts. You may notice less satisfaction over time, longer sessions, and weaker climax. You might feel shame or regret, like you wasted time or loss of control or something's off. Physical symptoms. Prolonged arousal can cause discomfort, known as blue balls or pelvic tension. Too much friction or excessive pressure can lead to some injuries or even numbness. It can also mess with your sleep, and by keeping your arousal system overstimulated late at night. Behavioral changes. You might find yourself needing longer sessions but feeling less payoff. You might lose track of time. Partnered intimacy may feel harder to enjoy. You might begin to avoid partnered sex because you're less aroused, fearful of disappointment or conflict, or you might even replay pornography in your mind during the act. You might even prefer solo edging over real sex. Here's the thing, most people who edge regularly don't notice a problem until something feels flat. The loop gets louder, the satisfaction gets thinner, and partnered sex starts to feel, well, dull. Which makes you ask, how does edging affect partnered sex and sexual health? So this is one of the most common questions I hear from patients. And let's look at this through a clinical neuroscience lens. Repeated edging effectively rewires how your brain experiences arousal. Your brain is plastic. It adapts to what is practiced. More practice means more adaptation. If you constantly pair arousal with fast novelty from changing categories, quickly switching through browser tabs, visual and audio layering, and delay climax, then your body learns and calibrates that these are the new conditions for climax. Over time, this creates a pattern. Solo orgasm becomes easy with porn and edging, but partnered sex, it feels too slow, too flat, or too emotionally unpredictable. This can lead to delayed ejaculation with a partner, erection issues without clear medical cause, loss of interest in non-porn stimuli and other sexual activities, as well as an emotional disconnection during real intimacy. The good news, it's usually reversible, but awareness is key, because without it, your body keeps reinforcing the loop it knows best. Does edging make orgasms more intense? Yes, to a point. They report the longer they stay at the edge, the more powerful the eventual climax becomes. But then again, only to a certain point. Edging increases dopamine, amplifies tension, and creates a sharper release in sensation and emotional intensity. But here's the catch. Your brain starts to expect that exact build-up for repeated sessions. And your brain, again, calibrates that these are the new conditions for climax. In other words, the orgasm only feels right if it follows a certain pattern. Quick regular climax might start to feel disappointing. Partnered sex starts to feel off script and it violates the new conditions. If you always use a roller coaster to feel something, then a gentle walk isn't going to cut it. The rise of unique arousal patterns. Now, many people develop specific rigid conditions, patterns, or rituals for climax. Examples include a certain hand pressure, edging for a set amount of time, specific categories or fantasies, specific visual or audio setup paired with devices, taboo or role-based themes, pairing with substance abuse. This isn't always pathological, but it becomes limiting when your arousal becomes inflexible and your climax requires a very specific sequence, which might lead to partner sex feeling underwhelming. Like a person who has conditioned themselves to only eat KFC for a specific intense taste sensation, or they can't look forward to when steak and vegetables are on the menu. Over time, this narrows erotic flexibility, which quietly erodes pleasure, connection, and shared intimacy. So why is edging so hard to stop? It's not about willpower, it's about dopamine, anticipation, and stacking. We've discussed this many times on the channel, but here's a refresher on the dopamine loop. Dopamine isn't the pleasure chemical, it's the pursuit chemical. It spikes not when you get something, it spikes when you're about to. Edging keeps you stuck in that anticipation state. It intensifies the pursuit process, leading to more rewarding climaxes. Add in multiple tabs, fantasy, and audio, you're stacking and charging up dopamine from multiple inputs, maintaining arousal far beyond what a single stimulus could contain. It's not that you're addicted to the orgasm, you're addicted to almost getting there. For some users, the almost there zone is so immersive that they use this zone to avoid and escape negative emotions. So you want to change your edging habits? Start here. Shift your expectations. Not every session needs to be mind-blowing. That expectation is often part of the problem. Sometimes a short, simple, even meh session is exactly what helps your system recalibrate. Think of it as a sub-maximal session, not because you're failing, but because you're teaching your brain to enjoy without chasing the peak. Good enough can be healing, and over time, good enough becomes plenty. Behavioral experiment? Try these. Climax earlier. Don't prolong it. See what happens. Use one input only. Stick to one stimulus. Avoid multiple tabs, highlights, or enhancements, such as substance use or devices. Try static images or your imagination. No motion, no sound. Learn to touch without porn. Let your body, not the screen, lead. Mindfully enjoy the whole experience, not just the anticipation of climax. I hope you found this useful. I'm Luke Vu. Be kind, be you. Catch you next time.